From KUNC and the NPR network, this is In The NoCo. I'm Erin O'Toole. Millions of kids in the U.S. will suffer a concussion during childhood, according to a recent study by the Centers for Disease Control and Prevention. Concussions are brain injuries that cause headaches and dizziness and nausea, and it can take weeks to fully recover. In recent years, doctors have changed the way they treat them. Instead of avoiding activity, doctors now recommend light physical activity while a child recovers from a concussion.
If you think about taking an active kid who's used to doing sports and going to school and running around with their friends and things, and then you tell him to just sit and rest, this is not going to go well.
That's Dr. Julie Wilson. She's a pediatric sports medicine physician and co-director of the concussion program at Children's Hospital Colorado. She says doctors and school nurses in Colorado have kept up with the new guidance, and the State Department of Education formally adopted those guidelines recently. But Julie says some parents and caregivers haven't gotten the message. So she talked with me about why she's made it her mission to educate the public to think differently about kids and concussions.
The research tells us that on average, exercise can accelerate recovery by about 4.5 days during concussion recovery. So you're taking an injury that may take a few weeks to recover and dropping that by half a week or more. That's pretty meaningful.
Let's start by talking about what a concussion really is. A lot of people may think a concussion is bruising or bleeding on the brain, but that's not accurate. Can you paint a picture of what happens in the brain during a concussion?
So a concussion occurs after some sort of force is applied to the brain. That can happen from a direct strike to the head or a force that comes up through the body or the neck, such as like getting checked in a sport like hockey or lacrosse, or potentially from an acceleration-deceleration force like a whiplash in a car accident. What happens in the brain is that instead of having a structural injury that's not bleeding or bruising, but it's more of what I think of as like a chemical or electrical disturbance in the brain, where basically the chemicals get a little bit scrambled. And that's where symptoms and the dysfunction in the brain comes from, is this kind of imbalance in the brain.
Now, we often think about concussions as sports injuries. I mean, you mentioned lacrosse and football and hockey. How much are concussions in kids caused by sports as opposed to another physical activity?
Sport-related concussion is very common, like you mentioned, but we also have to remember that it can happen from slips and falls, like on icy sidewalks or falls down the stairs in other situations. So it's really important to remember that it's certainly can happen outside of the sports context.
And that kind of goes against how we think about concussions. I know I've heard a lot about brain injuries in the NFL. How do you think the news about the NFL influences the way we think about concussions?
Well, I think on the one hand, it can be really helpful to see professional athletes being evaluated for concussion in a public setting. So seeing athletes get removed from the field of play to have an appropriate concussion evaluation, I think is helpful, because then it can help people understand why we may do something similar in their youth athlete as well. I think the challenging thing that also happens in that setting is sometimes, unfortunately, there's a high-profile case where perhaps the athlete continued to play or was returned to play, and that may not have been the best decision.
Right.
And so you see the good and the bad sometimes in the professional sports world.
What should we be looking for to determine if a child may have had a concussion?
We're really looking for what we call observable signs. So something that is different than normal behavior. So it might be loss of balance or incoordination. They're stumbling or they look unsteady. They may have a vacant stare or the kind of lights on, nobody's home look. They just don't look or act like themselves. And then there are also the things that people report, meaning the symptoms: headache, dizziness, nausea, feeling foggy, feeling tired, trouble remembering, trouble focusing. The symptoms are also a key element of concussion diagnosis.
Let's talk about the treatment here. The old recommendations for someone recovering were to avoid exercise, maybe avoid reading or other things that provide mental stimulation. How would that end up being counterproductive to recovery?
The important thing to understand about rest is that it's helpful likely in a brief and small amount. But usually in the first day or two is when the symptoms are most prominent and at their highest level. And then as those symptoms stabilize and potentially start to improve, we want to have the patient engage in their typical daily activity, interacting with friends and family and going to school and taking walks and getting back out into life. We see from one, just patient experience, but two, also studies of patients who were prescribed rest, don't go to school, don't do schoolwork, don't do your physical activity, that they actually are reporting more symptoms and taking longer to recover than people who start to get back to their daily activity within a day or two. And then even more exciting is that when we get people exercising after the first couple of days, we can actually accelerate their recovery even more.
Let's talk about how guidelines for treatment have changed in recent years. After a day or two, doctors now recommend light exercise and a return to school. Give an example of a patient you had where you could clearly see recovery working better when they were active than when they were on bed rest, let's say.
Sure. And I would say I see this scenario not infrequently. One patient I can think of saw me, I think, about a week after his injury. He had been home from school the whole time, had not gone to school. His sleep was very disrupted because he was sleeping all day and couldn't sleep at night. And so we talked a lot about getting him back into that normal routine, figuring out a plan to manage his symptoms so he could go to school, start to make up his work without being super stressed. But a big piece of it too, for this patient, I think, was getting him some physical activity. So we talked a lot about what could he do. He had access to some exercise equipment in his basement, also things he liked to do outside. So getting him moving, getting him active, getting him back at watching practice with his team just to have that social outlet. And so he came back then later feeling better.
Wow.
I asked the family, what do you think was the turning point? What really helped you? And this family particularly felt like getting him the physical activity and getting him engaged with his peers again for him was a big turning point that helped him feel back to normal. I'm using physical activity as a treatment to help you recover from your concussion, but I don't want you in a team-based activity while you're still recovering. But you can walk, you can jog, you can ride a stationary bike, you might be able to do yoga or swim or do some other things that are reasonable. And that's physical activity during recovery. So we can often talk about what is like sport-specific activity they could do, but just in a way that's lower risk and away from that intensive team participation.
Dr. Julie Wilson is a pediatric sports medicine physician at the Sports Medicine Center and co-director of the concussion program at Children's Hospital, Colorado. If you want to learn more about treatment guidelines and how to spot concussions, you can find links in our show notes and at KUNC.org. That's it today for In The NoCo. I'm Erin O'Toole. Thanks for listening.